Good morning, Dr. Deuk here with one of my patients who had the Deuk laser disc repair on her neck done yesterday. That was September 29th, 2020. So we're here on September 30th, getting ready to flip over to a new month.
Yes.
Right? And you're here, and you should see that you have the steri strips. So you had the surgery done yesterday to fix 2 disc herniations.
Yes.
How are you feeling today?
I'm feeling amazing today. I cannot thank you enough, truly.
Oh, you're welcome.
Before I got here, I had gone to my family doctor and I told him I was in such extreme pain, I needed help. And he took an x-ray and he said there was nothing wrong and to take ibuprofen. And I kept trying to explain to him that the pain was off the chart, excruciating. So I went to a back surgeon who did listen, and he offered me a lot of pain meds and signed me up for surgery. But the more I researched that surgery, I knew I didn't want to have that surgery. I didn't want them pushing everything over. It was going to be a fusion surgery. And they were talking about pushing over everything so that they could do the surgery and that there could be breathing complications, there could be speaking complications, swallowing complications, and I have asthma, so that wasn't really something that I wanted to go through. And I've had scoliosis surgery, so I've had rods and things before, and I didn't really want that in my neck. And the more I researched it, and then I even watched your video last week where it can get fused wrong.
Oh yeah.
And I didn't want that to happen either. And so I found you, actually I reached out on a Facebook room for people with neck problems, and somebody mentioned you in there.
Oh good.
And so I looked you up and found you, and I was really excited to even know that there was an option for this surgery. And in all of your videos, you say how great the surgery is, but you know, I think getting to actually see it and feel it is proof in the pudding right there. So
Well, thank you.
it is an amazing surgery.
Now, you know I've done over 1,000 fusions myself, so it's not that fusions wouldn't fix your problem, it's that you'd have a big incision, trouble swallowing, all the scar tissue, and then you'd have stiffness where those bones are fused because there's no more movement there. So you would be limited in turning and moving your neck around. You would lose that movement at those 2 discs that we fixed without fusing you. And of course you have no metal in your neck, you have a 4mm incision.
Right.
And you went home an hour after your surgery.
Yes, I did sleep quite a bit yesterday. I was pretty groggy from the meds, but I woke up at 3 and I felt amazing, and we had some lunch, and then we went to the beach and we got to go. I walked a good portion of the beach with my family, and we got to get out, and we're planning on going and doing some more shopping and getting out and doing things, and I can move my neck.
Great.
People in the videos never move their neck, and I'm like, can they not move it, or are they just being cautious? So
yeah, they can move it. I think everyone's just being cautious because I scare them. I tell them don't do too much because you don't want to re-injure that disc. It still needs to heal. It takes a year to fully heal. But the pain's gone. Now you had neck pain, you had left arm symptoms. Tell us about your pain and your arm symptoms before the surgery.
My pain, it originated back at Easter time, and I would wake up in the middle of the night and my arm was like this deep fire pain. I was really concerned I was having a heart attack, and so I did a lot of research on it, and I was also having really stiff neck. Well, it ended up going away on its own within a month, and I thought, great, we'll move on with life. In July, I woke up and I was in excruciating pain. It started at the base of my head and ran down my left ear, all the way down my arm. My pointer finger was completely numb. I had no feeling in it. I could prick it with a needle, no feeling. I had extreme pain in my left shoulder blade, and it was just this incredible pinching, binding, burning, aching type feeling that you could not escape from. And I could not lean back in my chair because the shoulder blade hurt so bad. Sitting up straight made everything worse. If I stood, I was fine, but you can't sleep standing up. And so I went about 3 days without sleep and realized it's not going to go away. I can't even tolerate this anymore. And that's when I went to my family doctor, and then I ended up going to a spinal surgeon, and he did listen, and he was going to help me, but it wasn't the option that I wanted. I wanted to come here. I wanted something less invasive, something that I feel I will be healing faster with. And obviously the neck brace is great because you feel amazing after the surgery. You don't feel like you have any limitations. And at least having the neck brace will remind me that I have limitations. I can't be doing things that because you feel like you can. You feel like you can just get out there, dive off a diving board, and do whatever you feel like for the afternoon, and it's amazing. You don't feel like you've had surgery. I've had multiple surgeries. This was the easiest surgery to wake up from.
Good.
It was a pain-free wake up, and again, it's incredible how there's no pain. I don't really think that that's possible with surgery, but it is.
It is, and I try telling people that we can cure their pain, and people online think I'm crazy. They're like, get out of here, you're Satan, you know, trying to poison these people's minds. I'm like, no, you don't understand. We've broken through. We can cure the neck pain, we can cure the back pain.
It's amazing.
And this laser surgery we're doing is working. So did you have headaches before?
I did. I was having deep headaches, but they were like at the base of my head and just kind of felt like my head was being squeezed in a vice. And so even like at night trying to lay down in the pillow, that was an in-between symptom between Easter till today. If I laid down my head on a pillow, it just felt like it was getting squeezed and deep headaches down my neck.
Do you still have those headaches?
No, they're gone.
Yeah, so the headaches are gone because they're coming from your herniated disc.
Yeah.
And the pain down your arm is
just
gone.
completely gone.
Even your numbness is gone. And I tell everybody, give it 6 months on the numbness, 6 months to a year, but you're lucky yours went away right away. So that's not typical. Most people it lasts longer, but yours went away, and I'm happy for you.
It's amazing. It's a miracle. And my other issue was about last week, all the pain was starting to shift and starting on my right side as well. I was starting to get pins and needles and aches, and I was like, oh my goodness, we have got to get on this immediately.
It's so funny you say that, because during the surgery yesterday when I was doing your C6-7 disc, and you'll see the video, I went and looked at the right side of your disc, and there was a herniation there. And
Well,
so we got it out.
That's awesome.
Yeah. And then at 5'6", I also kind of looked to the right side, but there wasn't a herniation at 5'6". So 5'6" was all left side, but 6'7", the bottom one, was definitely both sides. And I took care of both sides, and I said, you'll hear it in the video, I said, yeah, there's a herniation on the right side. I don't think she had any right side symptoms, but she would soon.
Yeah,
and now I'm hearing from you that you were developing right sided symptoms. So thank God we did it.
Yes, thank you.
We took care of it, yeah.
It was, I was just like, oh my goodness, this is just gonna, I don't know what I'm gonna do if I have both arms being completely limp and in pain. I'll be horrible. So I am so thrilled. I cannot speak highly enough about this surgery. Thank you so much.
Praise God. I'm happy for you.
It's just a miracle. I am so happy.
Well, let's talk for a minute, because it's concerning. You said you went to your primary care doctor, and I thought you said that they kind of just said there's nothing wrong, and...
Right. He took an x-ray, and they looked at it, and he said I had slight arthritis building up in my neck. And it was because I was getting older. Yeah. Which I'm 40, and so I don't.
That was not the problem,
I don't
was
think
it?
that the arthritis was the issue.
No,
I'm like,
it wasn't.
believe me, I know back pain, I know aches and pains, but he said just go home and take ibuprofen and food it off like it was nothing.
Yeah. So what you had was a misdiagnosis, unfortunately, by a doctor, and it's an all too common thing that happens, and that's why there's people like you who suffer for years and years because their doctors are just leading them in the wrong direction.
And it's very unfortunate.
Yeah.
So if you have aches and pains, get a second opinion. Find somebody else that will listen. Because again, my spine doctor listened, and he took an MRI the very next day, and that's when and I could barely get on that MRI table. I was just in this tense pain because of my back and my arm.
Spasming. Yeah.
It was just, it's like the worst Charlie horse burning cramp that you can imagine. And so I was laying there, and I'm like, I am so sorry, but I'm in so much pain. And she did it as fast as she could, and she was like, I am so sorry. You do look like you would be having pain.
Yeah,
so.
Of course. And the surgeon that you saw was in Kansas?
Yes.
And where are you from in Kansas?
I'm from Wichita.
So, I talked about this, you'll hear it in the video, but I almost took a job in Olathe, Kansas.
Oh, really?
Yeah, my wife and I went out there and looked at it.
I wish you would have. You'd have been much closer.
But anyway, I almost ended up there. I don't know that I would have learned the endoscopic surgery if I wasn't here in Florida at exactly the right spot. I wouldn't have met the right person who came into my life. They'd introduced me to the people overseas, and that's where I was trained. So had I been in Olathe, I don't think I would have ever learned this technique.
So it's a God thing that you're here.
Yeah, I truly believe that. God has directed us in my life so that I could be here to take care of people like you with this amazing surgery. But this endoscopic surgery is not available in Kansas, is it?
No, it is not. It's really not available anywhere. I was looking online after I found out about you. I'm like, because he's in Florida. There's got to be somebody closer. And I looked, and I couldn't find it anywhere else, especially with your specific technique.
Yeah.
I also felt a lot more comfortable because I could actually watch the surgeries. And with all of the surgeries that go live, or even just the ones that are on YouTube,
Yep.
to be able to go and see actual surgeries, to see what you're doing,
Yep.
hearing your confidence, but also seeing there's no mistakes being made, there isn't any issues. My greatest fear was that you would go straight through the hernia and into the spinal cord, but
Yeah.
you didn't do that on any of your videos, and so I felt a lot more comfortable and confident that that was not going to be an issue. Whereas anybody else, you know, that just says, yeah, I'm a great doctor, but they don't have any ways to show you that they're a great doctor.
And that's why I believe that people should see everything that they can see through the surgeon's eye, the doctor's eye, the patient's eye. Just get the whole 360 experience to understand it. But the truth is the Koreans, the South Koreans are the ones who taught me the access to get in there, how to do the basics. I'm the one who developed the annular debridement, which is so important to fixing the pain. But the Koreans have paralyzed a few patients for exactly that reason. They actually keep their patients awake, and the patients, I've seen them, they move around in pain during the surgery, and they went and got the spinal cord a couple of times, and they've stopped doing the endoscopic cervical approaches. All you got to do is follow the rules. I'm a big rule follower. I believe you figure out what's the best way to do things, you make it a rule, you follow it every single time, and you stay out of trouble. So my patients are asleep, they're not moving, and I've never injured the spinal cord, thank God. So.
Yes, and thank God I wasn't your first.
No, my first was 15 years ago. And it was very nerve-wracking for me doing this the first few times, like probably the first 20 times.
I can imagine.
I was very scared, but the results kept being really good, and I just couldn't stop. I knew that this had to be developed properly, and that eventually it had to be disseminated so everyone could do it.
Well, and the amazing thing is that you did this just a few days after your own surgery.
Yeah.
And so, I mean, oh my goodness, I can't thank you enough that you came in. I was like, if he just had surgery, I don't want a new guy. I want Dr. Deuk, so I will reschedule if I have to.
Yeah, there's no new guy, it's me. But you're right, I had sinus surgery. I put it off for 35 years. I had a broken nose from playing basketball in high school, and my sinuses were just killing me. So the ENT doctor told me, Friday you're going to have your surgery, you'll be back to work on Monday, it'll be easy peasy Japanesey. And of course, you know, that's what I talk about, is like it sounds so easy, but then again, here I am, and I have to go back in and get things looked at and cleaned out.
Yep.
Things are going well, but I couldn't come back to work on Monday because I wasn't ready to come back. So, and here you are with my laser endoscopic surgery, and you were like, it's the real deal. You're ready to go home. There's no issues or complications.
Yeah.
So I'm happy for you.
Well, I told my mom, and she was like, well, he's kind of put himself up a creek without a paddle, that he's the best of the best. Who do you go to when you're in pain? You know, because you were just amazing. I told the kids that I was going to the Doctor Strange doctor, that he was the best of the best, and there was nothing to worry about.
Thank you. You're very sweet, and I've really enjoyed our interview.
Well, thank you so much. I cannot say enough about Dr. Deuk, about the surgery, about everything here. It's been amazing. And again, I'm going to have to put my neck collar on because I don't have any pain at all. And I was in extreme pain before. So, I mean, tear pain. Like, I was crying to my husband, I've got to do something, lop off my arm or something, but I need to get rid of this pain. So, yeah. I can't thank you enough for ridding the pain and just giving me my life back.
You're welcome. Safe travels back home to Kansas, and maybe someday I can come visit you out there.
Move to Olathe now that you have your practice.
Gotta talk to my wife.
You'd be in the middle of the country, everybody would have easy access.
All right. Great seeing you guys. Go back to